I have some implants. I guess I've been a patient with Dr. Chang's for, I think, 5 to 6 years, maybe 7, something like that. And I had an implant done by another dentist before I came here. And when I came here, I had a partial. And that was because when I was 22 years old or 23 years old, I didn't have any money. And so an option for teeth was to pull 2 teeth rather than have a root canal and so on. I couldn't afford it. I had a young family, 2 kids and so on, and there was no way that I could come up with that money. So I had those teeth pulled and relied after a while on a wisdom tooth to fill in the gap. And that worked for a while, and then finally I had to have a partial. And as you've seen in some of the photographs, the partial did not last. And so one of the things that I really respect about Dr. Chang is that he really went over some of these possibilities, as he's suggesting, as to what is a workable plan. And at that time I did have some dental insurance, and we structured it so I think it was over a 2-year period in which he was able to do the implant, some of the basic pieces, and then the next steps, and then we put that off to the next year to pay for the next part of it, which was very helpful. But I think the thing that I would say to you about Dr. Chang is the skill in which he has in doing the implant. Having worked with another dentist, I can tell you that his procedure and the careful work that he has done is really extraordinary, and I'm very appreciative for his good dentistry in my mouth. It's the only mouth I have, and so he's made sure that it's still able to eat and talk and so on. So if you have some questions, I'd be glad to answer them, but hope that's helpful.
Yeah, thank you.
He called me up the last minute and said, "Would you come and eat?"